welcome back. I'm David Rice. I'm the founder of IgniteDDS, here with my partner in crime, Kevin Henry.
Dave Rice, always good to see you, my friend. Looking forward to diving into another topic today, brother.
I am too. I'm looking forward to getting over the pure exhaustion we all feel when
Man,
patients tell us no.
we've had a lot to be exhausted over the last year or so. Let's be perfectly honest here. But I think that no and hearing it time and time and time and time again in the practice is something that dental practices were battling way before we knew what COVID-19 was.
Oh gosh, yeah. Yeah, it's an age-old issue. And there are some real solutions. So those of you who are watching, get ready. I think some of the how-to might surprise some of you at foundationally where it comes from, but I can share with you that we didn't just learn these lessons from one practice in East Amherst, New York. We certainly have lived them for over 25 years, but this is tried and true with practices all over the US for the last 20, 30 years.
And one thing that I know our listeners and our readers love is the been there, done that, and learning from others. Dave, you started Together We Rise as part of Ignite so long ago, and this is a great example of that, is learning what has worked from others and then seeing how it can implement into your own practice and business.
Very true. Very true. So we're going to hit 3 different pieces of this today. And then I know at the end, I think we're going to have a pretty good next step for everybody.
I think we are. Get ready for that call to action, as we like to say in the business. Yeah, absolutely. But let's dive in with that first point, man.
Yeah. So, first point that I learned the hard way is as the dentist, as the owner, I had to have a crystal clear picture. You've heard of vision, you've heard about mission, you've heard about philosophy, practice philosophies, but I had to walk into my practice doors and know who I wanted us to be, who I wanted us to treat, what types, styles, how long we wanted for each procedure to bring to my team. That's on me, the dentist.
And I think that's so important for the team to hear, because you are, and I know leadership it can be seen as a cliche word sometimes, in our industry, but as the leader, the team's looking to you to say, okay, who are we? Who do we want to be? How do we want to be viewed in the community? Where do we want to give back? Where are we going to be a year from now? I think that is a team talk that needs to happen, but I think it's got to start with some kind of foundation from you as the dentist.
100%. So I don't mean to detract from team members, but I'm going to tell you that your dentist, it's their job, and dentists, I don't mean to put too much in shoulders, but it is your job to walk in and say, here's the easiest way to look at it. If I designed the perfect day in our practice, what's it look like? Who are we working on? What types of procedures? How long do we get? How do we want to get paid? Just pick one day and imagine your perfect day dentist, and then bring that day to your team. It's not up for debate. It's your vision. Where the team comes in is that second piece.
And you and I both know that there are procedures in the practice that some dentists, shall we say, enjoy more than others or look forward to more than others. And I think it's okay for dental dentists to say, I'd rather send this to somebody else. I'd rather not have this as a part of the mix. And yeah, in the short term, it may lose some revenue. It may lose some patients. But at what cost is it whenever you know that you're not looking forward to it, your team can sense that you're not looking forward to it. And like you said, it doesn't fit that vision of what you want to be doing and what your perfect day looks like.
I love that you share that. I'll tell all of you my own personal experience. So we made a conscious decision years ago that we would, by design, refer out lots of dentistry. We never did endo in our practice because my partner and I didn't like it very much. So to your point, people would have seen that we didn't like it.
Sure.
And if we didn't like it, we probably wouldn't be all that great at it. Now, how that helped us was every endodontist that we work with, they got to see our dentistry. They got to see a temporary crown or a definitive composite or definitive ceramics. And when they consistently saw great work, it made them comfortable to say, wow, maybe we should refer patients back. So you can choose to keep it all in-house. You can choose to refer it all out. You can pick and choose whatever your lane is. Just have a strategy behind it.
I think what you just said may have blown a few minds, to be perfectly honest, because you're right. I think in the short term, dentists always look at it as I'm losing production, I'm losing patients to someone else. But you're exactly right. If you're doing the work and the beautiful work that you should be doing, it's almost a calling card to that specialist or to that other dentist. And you're absolutely right. The referrals can come right back. And it's such a great point, man.
And if you're a GP, you should expect referrals to come back. So part of this vision that you're creating, our job is not only to share it with our internal team, but our job is to share it with our external team, our specialists being part of that, our ceramists, our labs being part of that, our reps that we work with in our practice are a part of that. And imagine that you hold these beliefs so strongly, and then you take that next step and you translate those beliefs to everyone around you. Now the oral surgeon knows, the endodontist knows, the periodontist knows what you expect and what you're delivering, and they're looking for it. Every time you send a patient there, they're looking for an opportunity to help back, and it moves far more quickly than you'd imagine when you do that.
And you mentioned the rep, and I'm thinking about those reps that come into your practice and they know who you are. They know what you stand for. They know where you want to be, and just how that almost creates then a mindset for helping them help you get to that mindset more instead of them just throwing everything at the wall and seeing what might stick.
Absolutely, which is, part two. So when we talk team, we'll look at, internal to our four walls and external reps being a big part of that. But imagine your, hygienist assistants who are watching, everything that I know and how we together are going to make this thing happen. Like, how much more comfortable are you? How much happier are you? Because we're building this thing together. That's what reps think and everybody else in the world thinks. And now collectively united, we're an unstoppable machine.
And man, when the team is happy and there's that harmony in the practice and everybody feels like that they don't have to wonder what's coming next, and they know from the dentist, here's where we want to be at the end of this week, at the end of this month, at the end of this quarter, at the end of this year. It's such a relief, I think, for so many folks, because they've got almost that playbook ahead of them and they know their role in it and where the business wants to be and what they've got to do to make that happen.
Absolutely. So just picture, right? We're all sitting at a big table together and we decide, like, this is our perfect day. It looks like this. Now, we're not going to create our perfect day every day in the beginning. It's our goal. But maybe we get to one a week, and one a week's a huge victory. And then eventually it's 2 and 3 and 4. But once we know what that looks like, how much easier is it for us to achieve it when we can say, all right, Kevin, so how do you think we make that day happen? And we go around the room and we listen to everybody's advice.
And as a team member, I need to come prepared to actually have, what does my perfect day look like? But it's not just about, well, let's make me happy. This has got to be about fitting it in with the vision, again, that was set by the dentist.
Mm-hmm.
How will something that I bring to the table help make that vision come to life? And ultimately, hopefully, yeah, it benefits me. But again, the framework is already there, and everybody needs to be prepared for what's to come and what that looks like in their mind.
Absolutely. I know this when it comes to hygiene and just, periodontal health. I always look to our four hygienists and say, like, okay, how should we do this? Mm-hmm. You're our experts. And when it comes to, anything on the restorative side, we look to our dental assistants like, okay, what happens the moment I get up and walk out of the room. So how do we set this up to have better conversations? How do we order properly? How do we work better together so we can be efficient?
And I think that's such a key part of leadership right there, is the fact that you're not telling them, here's how we're going to do it. You're setting that framework, but still giving them the freedom and, shall I say, their own little moments of leadership to say, you're right, Dr. Rice, after you leave the room, here's what happens. And here's what I know I have to be prepared to talk about when that patient says, do I really need this crown?
100%. And I think that's where we get really, really strong together. As you said it, like the dentist, your job is just to set the frame. After that, we all work out the how-tos and the what ifs when it goes well, what happens when it goes wrong, what do we do from there? That's what we do together. And then I think a large part of it is the confidence in one another to say, we're going to fall down. We're going to make mistakes. But so long as we come from the right place and we're consistently doing what we promised to do, it's okay. It's okay to make mistakes.
And I think back to a video you did, and it's been a while ago, but the message that you had in there stuck with me a lot. And you were talking about, and you held up different picture frames, and then you put the same picture in them and how that picture, morphed with the different frame. And I think we've got to think of practices with different frames as well. This isn't a cookie cutter approach, and what may work perfectly for your practice may not for somebody else's. And we've got to realize that we can't just take what Dr. Rice says and just 100% say, well, perfect, there, we'll put it in. It's got to have your own flavor. You've got to know your own team. You've got to have your own vision for where you want to be a year from now. Post-COVID, what does your dental practice look like? These are the things that you've got to know so that frame isn't just what you hear from a consultant, what you hear from us, but it's really something that fits where you want your business to be.
That's an excellent point. And I'll add to that my favorite coaches and consultants in the industry are people who have a wide breadth of experience, because a small boutique dental practice is very different than a practice that has 10 locations. Now, systems are systems. Human behavior is human behavior. How we deliver those systems and how we deliver that human behavior, it's like you said, it inevitably has to be different inside everybody's four walls. Principally the same, delivery different based on what your perfect day looks like, not mine. Now, if yours happens to be mine, I can give you a 100% recipe to work anywhere. If yours happens to be one of volume, like mine is low volume. We do lots of dentistry, but I have a lot of friends, Kev, we know a lot of people in the industry who are 180 degrees from that.
Oh, absolutely.
So our job is to connect you with those people because they can build that frame better than we can build that frame.
And you hit on an excellent point. I'm going to take a little bit of a tangent here, but you talked about whether you're a small boutique practice or you've got 10 practices. And I think we've got to realize if you're that small boutique practice, and all you're thinking about is how I can compete with this regional DSO, or how I can, if you're a regional DSO, how I can compete with a larger DSO, and if that's your mindset, I don't think that that's really going to work. It's got to be what works for you in your bubble, irregardless of what anybody else in the business is doing. Here's what works for us. Here's what our perfect day looks like. Here's where our team strengths lie. And then you build on that.
Absolutely. So I don't know if did you ever read The Art of War?
Yes, absolutely.
Okay. So The Art of War, for those of you who haven't read it, read it. But it's know what you're really, really great at strategically, and know what your enemy, your opponent, can't replicate, and be really great at what you're great at, and then learn to be really great at what it's really difficult for other practices to do. So as a more boutique style dental practice, I don't ever look to a big group that scales and try to become them, because what we're really good at in our practice are things they could never achieve. Now, they're really good at some things that we could never achieve. That's wonderful, because there are patients who love that, and patients who love us, and patients who love your model. You just have to be very strategic in your nature. And it starts with, what's your perfect day look like?
And I think back to that phrase I've heard so often, you can't be all things to all people.
No.
And I think the dental practices that try to do that, more frustration comes out of them than I think than most that you and I visit.
Dental friends, look at any business you've ever seen outside of dentistry and ask yourself, who are the peak performers? Pick restaurants. It's the little restaurant that charges you a lot of money and delivers like the most amazing meal and experience in the world, or it's the chain that delivers consistency no matter where you are in the world. And then ask yourself, who struggles? Everybody else in the middle. So pick a lane and live in your lane. Don't pick the middle. The middle's a very dangerous place to try to be.
The middle's where you get run over. I'm telling you, exactly.
Yeah, right. Yeah.
Absolutely.
The big practices who have incredible systems down pat will always beat your systems. The smaller practices who deliver an incredible experience will always deliver a better experience. You can't be all things to all people. You have to choose.
Yeah. And I know for some people that choice is hard, but I think let's go all the way back around. If the dentist has the vision, the dentist has the framework, the dentist has the confidence in the team to help him or her build in that framework and what goes in there, I think that's a winning formula.
It is a winning formula. And no surprise to all of you watching, there are lots of practices, hopefully not yours, who are struggling to keep tremendous teams together.
Yeah.
This is why there's no clarity. So if you can gain clarity with each other, if you can consistently work on your business, on your culture as much as you work in it with your patients, those problems will go away. Promise you.
Yeah, one of the biggest trends that we're going to see in 2021 is how tough it's going to be to find people to replace people that you've lost. And we know that a lot of dental practices are adapting. We know a lot of dental practices are running lean right now. A lot of dental professionals, dentist, hygienists, and assistants, front office, they're all doing things that they didn't really anticipate they were going to be doing a year ago. But their job roles have changed because they're all trying to fill in. And so I think one of the biggest things that you and I both want to do is make sure that people understand not only how to find those great people, but maybe even more importantly, how to make sure you don't have to go through the finding process by keeping the great ones you've got in-house.
I love that. So we've got 3 big things we need to do from today, right? We have to have this vision, this mission. We have to share it with our team. And then we have to stay accountable to one another every single day.
Big time.
And then when the roads get rough and rocky in 2021, which we know they will, what's coming next?
Well, I think the biggest thing is that accountability, like you said. I mean, let's make sure that we're not pointing fingers and say, well, it's your fault. Well, I did my part. What about you? And again, I think that if that framework is there and everybody understands their role and you're using data to see who's performing well and maybe who isn't, and that you can work on those skills to raise everybody up to a level that is needed. I think that's where the accountability really comes in for big time.
Absolutely. So gang, my next logical question when I'm sitting in your seat right now is, okay, that's all great, but what happens when it's hitting the fan? So Kev, what happens when it's hitting the fan? How can we help?
Well, I think we're going to help by giving them some advice. And I think the best thing that we can do is, people hear us talk all the time. How about we actually give them something, that they can take into a team meeting that they can help build. So we're actually going to be able to give you a download, a 1-pager that we think is going to help a lot whenever things do hit the fan. So there's a download link right underneath here. We want to make sure that you hit that. You're going to get some information from Dave and I sent directly into your email, and it's going to be something, I promise you, it's going to be able to help you get out of the weeds and really get a lot more clarity from everybody in the practice.
Absolutely. It's how to adapt, how to get lean, how to go virtual, because that's a thing now, and how to make sure that your team is really well cross-trained. Kev, that was a lot of fun.
Hey, it always is, my friend. Always enjoy chatting with you and helping others. And hey, hit that download. Let's make sure that we give you the information you need.
Talk soon, gang.